The silent threat. Understanding abdominal aortic aneurysms, AAA. When we talk about heart health, we often focus on cholesterol levels, blood pressure, or the risk of a heart attack. Yet, there is a dangerous cardiovascular condition that often goes unnoticed until it becomes a medical emergency, the abdominal aortic aneurysm, AAA. Often referred to as a silent killer, and AAA can develop over many years without presenting any symptoms. Understanding what it is, who is at risk, and how it's detected is the best way to protect yourself or your loved ones. What is an abdominal aortic aneurysm? To understand in AAA, we first need to look at the aorta. The aorta is the largest artery in your body. It carries oxygen-rich blood from your heart down through your chest and into your abdomen. An aneurysm occurs when a section of this artery becomes weak and begins to bulge or balloon outward. Think of it like a weak spot on an inner tube or a garden hose that is starting to bulge under pressure. Because that section of the artery wall is stretched and thin, it is at risk of rupturing, which is a life-threatening medical emergency causing severe internal bleeding. Who is at risk? Not everyone is at equal risk for developing an AAA. Several key factors can increase the likelihood. Age. The risk increases significantly as you get older, particularly for those over 65. Smoking. This is the single most significant risk factor. Smoking damages the walls of the arteries and accelerates the growth of an aneurysm. Gender. Men are much more likely to develop an AAA than women. Family history. If a close relative has had an AAA, your risk is higher. High blood pressure and cholesterol. These conditions can damage and weaken the lining of the aorta over time. The problem with symptoms, or lack thereof, the most frightening aspect of an AAA is that most people don't feel a thing. By the time symptoms appear, the aneurysm may be large or at risk of rupture. When symptoms do occur, they may include a deep, constant pain in your abdomen or on the side of your abdomen. Lower back pain that won't go away. A pulsating sensation near the navel. You may literally feel your heart beating in your abdomen. If you experience sudden, severe stomach or back pain, seek emergency medical attention immediately. The power of screening. Because AAAs are often asymptomatic, medical professionals rely heavily on screening. A simple, painless abdominal ultrasound is the gold standard for detecting an aneurysm. Who should be screened? The U.S. Preventive Services Task Force recommends a one-time ultrasound screening for men aged 65 to 75 who have ever smoked. Men aged 65 to 75 with a family history of AAA. If you fall into these categories, or if you have concerns about your vascular health, talk to your doctor. A few minutes of testing can provide peace of mind or lead to life-saving early intervention. How is it treated? If an aneurysm is found, the treatment plan depends on its size and how fast it's growing. Active surveillance. If the aneurysm is small, your doctor may simply monitor it with regular ultrasounds to ensure it isn't growing rapidly. Surgery. If the aneurysm is large or growing quickly, surgery may be required to reinforce the wall of the aorta, often using a stent graft, a specialized tube, to bypass the weak area. Final thoughts. You cannot control your age or your genetics, but you can control other risk factors. Quitting smoking is the most effective thing you can do to protect your vascular health. Maintaining a healthy blood pressure and staying physically active also play vital roles in keeping your arteries strong. Don't wait for symptoms to appear. If you are in a high-risk group, make an appointment with your primary care physician today. A quick chat about screening could be the most important health decision you make this year. Disclaimer: this blog post is for informational purposes only and does not constitute medical advice. Always consult with a healthcare professional regarding your specific health concerns or medical conditions.